This is Dr. Fab Mancini, and I'm so excited to be with you today because I have one of my favorite people in the world, one of the most successful chiropractors in the United States, Dr. Jody Serra. Jody, it's so good to see you, man.
Thank you, Fab. Appreciate it. It's always good to talk to you, brother.
So for people that may not know about you like the way I do, tell us briefly about where you practice and your journey as a doctor of chiropractic.
Of course. I graduated from Palmer back in 1982. I practiced in a small town in Western New Jersey that nobody's ever heard of until last week when it was the epicenter of the earthquake on the East Coast. It's a little town called Lebanon, to where I grew up. I went to grammar school and high school here, so came back to my hometown, and it is the boondocks. It's pretty rural out in this part of New Jersey. That's where we're at today.
I was excited to have this conversation with you because you and I share something, and that is our love and passion for rapid release. And I know that you have built a tremendous practice, and part of that practice is to take care of some of the biggest elite athletes out there. So tell me a little bit about how did you discover rapid release, and what were you saying to yourself when you first saw the technology?
Well, I've worked with athletes since the 80s. Some of my first, I've worked with some NFL players and some Major League Baseball players. One of my first athletes was Joe Montana, as well as Jerry Rice. They played for the 49ers. I connected with them when they were on the East Coast through a good friend of mine out in California, Dr. Nick Athens, who I know you know. So we had some mutual patients. And back then, there really wasn't a lot of modalities. Especially things that you could bring to see these players on the road, like in their hotel rooms and stuff. So we basically had muscle stim and heat in our office. I think we used to do some trigger point and ultrasound, but that's basically it. And then as time went on, we picked up some percussive instruments, I think like hypervolt and those types of things. But rapid release came on board. I was at a Cal Jam seminar out in Costa Mesa, I think it was, maybe I'm going to say 8 or 9 years ago. And one of the vendors had something I'd never seen before. I'd never heard it. Sounded a little bit like a belt sander. That's when I met Cal, who you know, and I asked him about it, and he's like, you got any, I had a kind of a tight spot in my neck from crashing my mountain bike a couple weeks before, and he used it on me, and the pain was gone, and my range of motion was restored. So I'm like, I'm going to get one of these. So that's when we started with it. I started to bring it with me to use on every athlete. One of my main guys right now is Odell Beckham. I travel with him home and away, and see him in the off season too. And he loves it. We use it a lot. Specific things that I've done with it, we see tremendous results with pain in the shoulders, elbows, neck, back, particularly with that one athlete, Achilles. Pain in the Achilles was a pretty big deal. And we worked on some of the plantar fascia on the bottom of the feet, which actually allows the foot to flex a little bit better. And he saw instant relief from it. And he had me down there just at the end of this last season in Baltimore twice a week, through the playoffs. Unfortunately, they did not go to the Super Bowl. They were one win away from going to the Super Bowl, and we already had plans to go to Vegas, but they happened to lose to the Chiefs.
So when you think about the value of rapid release, I've asked the question myself. One of the things that I love is the fact that most of our patients see an immediate change, just like you experienced with your neck. We tend to do that. What would you say are some of the benefits that your patients are receiving by using this technology that has helped you build such an incredible practice?
Well, I mean, you hit the nail on the head with the instant change. I have patients check their range of motion, and they'll say it's restricted right there, and then we do, it can be a three-minute treatment, and then now the ear goes to the shoulder. So I think that kind of show and tell, I guess, is a good way to put it. Let people see where they're stuck and how this can help. I mean, obviously, I think it's great at reducing inflammation. It increases circulation. I think it might be a little tough for some people to get used to if they're used to like percussive instruments. Like, again, I don't know if I can name them, but like hypervolt and things like that, because those oscillate at a much slower frequency. I think it's, I don't even know, I'm not going to guess, but I know the rapid release is like 10,000 cycles per minute. So we tell them, hey, it's going to sound like a belt sander. It's going to feel a little bit weird on you, but you know, people love it. And once they have it and they see that result, yeah, they want it. So.
You know, there may be other doctors out there that may be watching this, that maybe they experienced it at a booth, at a seminar, or maybe they have heard about it. What would you tell, or what would you have liked for somebody to tell you when you were thinking about integrating rapid release in your practice? What do you wish somebody would have told you that you figured it out over the last few years by actually implementing it in your practice?
You know, I'm at a disadvantage there because the first time I saw it, I went home with one. No, I mean, I saw it at the, they were vendors at CalJam. I had never met them. And by the way, they were great people. I think once I had it done, I stopped by their booths maybe 6 other times over the week and I got it done on me, and I fell in love with it. So I was already sold, and it was just a matter of learning more and more about it to explain it to patients. And you know, we have to sort of put it into simpler terms so they can understand it. You know, I've never had, if I were a doc that hadn't used it and wasn't, you know, familiar with the technology, I would just say, you know, if you can find one, have somebody give you a little demo on it. I mean, the reps from the company are great. Call them, see if they can arrange it, see if they'll send you a demo or something like that. And, you know, like I said, every athlete that I've worked on, especially the NFL guys, I love it. And again, that's usually after the first time I use it on them. So.
Well, I just want to thank you for taking time from your busy practice to have this conversation with us. And most importantly, for all the work that you do, man. You've been an incredible model in this profession, and I'm a big fan, and I have a lot of respect for everything you've done. So I appreciate you. God bless, and I look forward to seeing you soon.
Thank you, Fab. I appreciate it. Thank you.